So the current generation of implants is called as the fifth generation of implants. One has to understand that the idea behind placement of a breast implant is that it should fit within the frame. It looks very artificial if the implant goes out of the frame. So we need to do some measurements of the height, of the width of the frame of a patient.
Does the implant interfere with the breastfeeding later in life?
Even if you take an implant and you try to cut it with a knife, you can cut it like an apple. Implant shell was made of a textured material.
Hello to all. Today we have Dr. Parag Telang, celebrity cosmetic plastic surgeon, with us to burst some myths and share some facts regarding breast augmentation with implants. So our first question is, what are the different types of implants?
When the implants were initially introduced, the implant shell was made of a textured material and they had a life of 8 to 10 years. But now we have moved on to a different type of generation of implants which are called as cohesive gel implants. So a cohesive gel implant is form stable. It does not change its form, it does not change its shape or size for the rest of your life. So the current generation of implants is called as the fifth generation of implants. So that's where we are at the moment.
So at designer bodies, what particular type of implant are we using?
We use implants which are USFDA approved and they are called as smooth implants or nano textured implants. So texturing is something which was associated with some health issues in few women in Europe, and that is why since the past 4 years texturing has been abandoned, and now most of the companies have moved to a new generation of implants which are very safe and they are called as smooth or nano textured. So that's what we use.
So does this mean that implant need not be changed throughout the life?
Yeah, these implants, they are not like the older generation, which it does not degrade, does not disintegrate. The silicone remains as it is. So these implants in fact come with a warranty card which says that these implants are form stable. So what does it mean? If the patient does not have any side effect such as a capsular contracture or any other problem health-wise, then these implants are for the rest of your life.
So can we say that these shall stay till the grave?
Yes, for sure, yeah.
Okay. So the next question is, how do we select the right size of the implant and what are the different sizes available?
So whenever a patient comes for choosing the optimal size, one has to understand that the idea behind placement of a breast implant is that it should fit within the frame. It looks very artificial if the implant goes out of the frame. So we need to do some measurements of the height, of the width of the frame of a patient so that we can come to a size which is going to match that patient. Now when I have patients who come for consultation, I give them a range. Okay, that this is the smallest size that you can be and this is the largest size that you can be. But I always say it is like buying a car. It really depends on you what car you want to buy. So similarly, it is also up to the patient what kind of size she would want to have. The other way of deciding the size of an implant is you can ask the patient to wear different padded bras and they can check the look in a mirror, and whatever padded bra is what the kind of look they want, then we can also keep that into mind in planning the size of the implant.
And what is the range of size available in the market?
So the implants normally start from 180cc and go all the way up to 1000, even 1200cc. But the larger implants above 500cc are not easily available. We need to procure an implant specifically for a patient because they are not that much in demand. The common sizes normally are between 300 to 500.
And now the most common question that we encounter is that does the implant interfere with the breastfeeding later in life?
The implants are placed in a plane which is behind the breast tissue. So there is no interference really with the breast gland or with the breast tissue. And in unmarried girls, we normally prefer to place the implant even further under the muscle. So there is definitely no way it can interfere with future breastfeeding in a young patient.
Okay, so our last question is, are there any fatal risks associated with the implants?
Nothing really. There have been many studies about the safety of these implants, and the very fact that these implants are FDA approved means that they have gone through a very rigorous kind of testing, and they are absolutely form stable. Even if you take an implant and you try to cut it with a knife, you can cut it like an apple, but it doesn't leak. It does because there is nothing liquid in the implant anymore. So these implants really are absolutely safe.
So thank you so much, doctor, for your precious time. So next time we shall discuss on another surgery. So if you have any suggestions, do let us know in the comment section below.
And don't forget to like and share this video and subscribe to our channel to know more.